Expert Microsuction Earwax Removal in Letchworth Garden City, Hertfordshire. The only specialist microsuction earwax removal clinic in Letchworth Garden City, providing microsuction earwax removal and manual instrument earwax removal by our expert earwax removal practitioners. All of our earwax removal practitioners are hand-picked by our founder, Jason Levy. We really are the earwax removal specialists. We really are the earwax removal experts in Letchworth. Frequently asked questions. I need earwax removal using microsuction, do you provide this service? Yes. I need earwax removal using manual instruments, do you provide this service? Yes. All of our microsuction practitioners are certified, trained and insured to provide manual instrument earwax removal, which is especially suitable for people who are very sensitive to loud noise. My ears are very sensitive to loud noise. Is microsuction earwax removal right for me? If you find that moderately loud noise like a vacuum cleaner or hand dryer causes you physical pain, then microsuction may not be right for you. Fortunately, all of our practitioners are trained to offer manual instrument earwax removal, which is especially suitable for people who are very sensitive to loud noise. Do you provide microsuction earwax removal for under 12s? Since the beginning of the COVID-19 crisis, we have unfortunately ceased to offer our service for under 12s. Yes. Our London Baker Street Microsuction Earwax Removal Clinic is open from 10 a.m. until 4 p.m. on Saturdays. Out-of-hours appointments are limited, so book early. If your ear has been examined by a doctor, nurse or audiologist and your earwax has been confirmed as being impacted, you should buy wax sol from a pharmacy and use it for 2 days before your procedure as advised in the patient leaflet. Otherwise, we recommend that you use 2 squirts of earl spray 2 to 3 times a day for at least 3 days before your procedure. When you come to your appointment, we will discuss any issues that may affect the procedure, examine your ear, then examine your ear with a portable ENT microscope. With 43 locations in London, Berks, Bucks, Cambridgeshire, Essex, Herts, Kent, Leicestershire, Norfolk, Oxfordshire, Suffolk, Surrey, Sussex, Staffordshire, Warwickshire, the West Midlands, Merseyside and Lancashire, we've got you covered. Do I need to soften my earwax? If you have confirmed soft earwax, then you do not need to soften it as it is already soft. In every other case, pre-softening the wax is recommended. In oral microsuction for wax impaction, survey of efficacy and patient perception, a significant finding was patients who had used serum analytics, eardrops or sprays, reported significantly less pain and vertigo, dizziness. Combining this important information with the study below, suction-generated noise levels during oral toilet, we can conclude that patients should use 2 to 3 squirts of earl spray, optionally with the addition of 3 glycerin drops 2 to 3 times a day, for at least 3 days prior to a microsuction procedure. Very hard impacted earwax can also be softened with wax sol used for 2 days prior to a microsuction procedure. The conclusion is that no one brand of ear drop has been comprehensively shown to be better than any other. Nevertheless, we still recommend the use of earol spray with the optional addition of glycerin drops, as this has been shown to increase the comfort as well as reduce the chances of vertigo during a microsuction procedure. We specifically recommend you do not use sodium bicarbonate or hydrogen peroxide ear drops. In a study called Suction-Generated Noise Levels During Oral Toilet, noise levels were measured in the ear of an artificial model head using various suction tubes on different substances. For this reason, we do not generally recommend the use of aggressive ear drops that contain sodium bicarbonate or urea hydrogen peroxide, as it can make earwax very watery, greatly increasing the noise level during the procedure. In addition, prolonged use of sodium bicarbonate ear drops can lead to an opportunistic infection of the ear canal, because sodium bicarbonate reduces the protective acidity level within the canal, and prolonged use of urea hydrogen peroxide drops can cause severe irritation to the skin surface in the ear canal in some people. Hydrogen peroxide is bleach, after all. Do you offer ear syringing or ear irrigation? Instead, we use the far safer microsuction and manual instrument methods to remove earwax. Syringing was routinely offered in GP surgeries, and was largely replaced in the 1980s with electric ear irrigators. However, in a 2002 article, Removal of Earwax, the BMJ reported that ear syringing carries with it a high chance of complications, perforation of the eardrum, otitis externa, damage to the external canal, pain, deafness, vertigo, and tinnitus are all possible with syringing. Microsuction is much safer than syringing, but requires a significantly higher level of training. All of our audiologists are handpicked and undergo additional training in advanced earwax removal methods, giving us an unrivaled success rate of 99.8%. Why do you say it does? We give research-backed reasons why you need to soften your earwax in the above answer to "Do I need to soften my earwax?" If they then find that your earwax is too hard, could you then be sure that they would stop and tell you that they weren't entirely honest and you do actually need to soften your earwax, and you'll have to come back at another time? We would rather be completely upfront, outlining the benefits of pre-softening with Earl for your safety and comfort, as well as it greatly improving the chances of a successful procedure. Do you provide microsuction earwax removal near me? We provide earwax removal for clients in Letchworth, Baldock, Hitchin, Royston, Stevenage, Biggleswade, Bedford, Sandy, Potton, Gamlingay, Norton, Church End, Radwell, Ickleford, Stotfold, Newnham, Ashwell, Odsey, Bygrave, Clothall Common, Astwick, Arlesey, Henlow, Clifton, Shefford, Wrestlingworth, Langford, Stanford, Edworth, Hinksworth, Coldcoat, Chicksands, Southill, Broome, Campden, Meppershall, Lower Stondon, Holwell, Stratton Park, Home, Newtown, Millow, Dunton, Potton, Beadlow, Lower Gravenhurst, Upton End, Shillington, Apsley End, Hexton, Blenheim, Moggerhanger, Barton-le-Clay, Charlton, St Hippolyt's, Preston, Offaly, Weston, Clothall, Cumberland Green, Cotterud, Ardley, Barleycroft End, Walken, Shore Green, Rushden, Wallington, Mill End, Sandon, Row Green, Thurfield, Reed End, Dane End, Kelshall, Thrift End, Neesworth, Bassingbourne, Melbourne, Meldreth, Frog End, Foxton, Shepworth, Wimpole, Orwell, Foulmere, Barrington, Bridgefoot, Wadden, Wendy, Shingay, Tadlow, Little Green, Gildon Morden, Great Chisel, Dudenhoe End, Newt Hampstead, Buntingford, Throcking, Furnopelham, Henlow Camp, Wadden Gap, Offaly and Little Offaly, as well as other towns and villages in Hertfordshire and Bedfordshire. How much does earwax removal in Letchworth cost? Pricing can vary if it is 1 or 2 ears, at peak or off-peak times, and how far in advance the booking is made.